most common glycogen storage disorder in children is its type 1, that is von Gierke disease. How to remember GSD in children? There is a very easy mnemonic to remember. It is very poor carbohydrate affect muscle and heart. V stands for von Gierke, poor. P stands for Pompey's, carbohydrate C for Corey's, affect A for Anderson, muscle M for McArdle, heart H for Hers. And there is very easy way to remember enzyme deficient also, that I am going to reveal at the end of the video. If there is a multiple fracture of fetal bone on antenatal USG, what could be the diagnosis? It's osteogenesis imperfecta. Welcome back to my channel. In today's video, we are going to learn many important one-liners for pediatric subject for INI CET May 2023. Do not skip anything, watch till the end. Hi, I am Dr. Triya pediatrician and consultant neonatologist. I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video because lot is going to happen for pediatric on this channel. So first is delayed dentition is called when there is no teeth eruption by the age of 13 months. It is mean plus 2 standard deviation. So what could be the causes delayed teeth eruption? It could be familial, rickets, idiopathic, endocrine causes such as hypothyroidism, hypoparathyroidism, as well as hypopituitarism, Down syndrome, cleidocranial dysplasia, or it could be progeria. The next is first sign of puberty in female is it's thelarche. Thelarche is a development of the breast because of puberty hormone. While first sign of puberty in male is testicular enlargement. So this is a chart which we have to remember. In girls it starts with thelarche, then pubarche, then growth spurt, and then menarche. In boys it starts from below to down. First there will be a testicular enlargement, then there will be a penile enlargement, then pubic hair growth, then there will be a growth spurt, then axillary hair development, and then there will be a development of facial hair. The next is, in any sick child with medical emergency, ABCDE steps are performed. So what are these steps? A stands for airway, B for breathing, C for circulation, D is for disability, that is for neurological assessment, in which we see how child responds. Child is alert. V stands for child is responding to verbal stimulus. P, child responds to painful stimulus, and U stands for child is unconscious or unresponsive. E is exposure. Definition of severe acute malnutrition for the child who are between the age of 6 months to 5 years, defined as presence of one or more of weight for height less than 70% or minus 3Z score, severe wasting, mid upper arm circumference less than 11.5 cm, or there will be a symmetrical bipedal edema of the nutritional origin. So this is the difference between kwashiyorkyor and marasmus. In kwashiyorkyor there will be a presence of edema, here it will be absent. Sensorium, the child will be apathic and will not be interested in surrounding. Here the child will be alert. Appetite will be poor in kwashiyorkyor, here it will be voracious appetite. Hepatomegaly is more commonly seen in kwashiyorkyor, not seen in marasmus. Skin and hair changes are seen in kwashiyorkyor, not in marasmus. Prognosis is very poor, here the prognosis is good. Earliest symptoms of vitamin A deficiency is night blindness. But the earliest sign of vitamin A deficiency is conjunctival xerosis. Zinc deficiency can lead to growth failure, diarrhea, hypogonadism, alopecia, poor wound healing, as well as acrodermatitis, enteropathica. It's a rare genetic autosomal recessive disorder. There will be a mutation of gene of membrane protein that binds to zinc. The defective gene is SLC39A4. This is a classical picture of acrodermatitis enteropathica in which the child will present with extensive rash, more commonly seen on all type of mucocutaneous junctions. Multiple fracture in antenatal USG, most likely diagnosis is osteogenesis imperfecta. It is also called brittle bone disease. The most common is autosomal dominant disorder. There is a triad of blue sclera, sensory neural hearing loss, and the fractures which can lead to bone deformities. Most common chromosomal abnormality in children is Down syndrome, and which is caused by maternal meiotic non-disjunction. 95% it is non-disjunction in maternal meiosis, 1% could be mosaic, rest could be translocation 21 and 14 and balanced translocation 21 by 21. Most common glycogen storage disorder in children is, we have already discussed at the beginning of video, it is von Gierke disease type 1 GSD. How to remember this? Von Gierke disease, V stands for von Gierke, here GG. Von Gierke glucose 6 phosphatase is deficient, poor Pompe M, lysosomal M, alpha 1,4 glucosidase, CBH carbohydrate, C stands for chories, and after C D will come, so in chories there will be a deficiency of D branching enzyme. Anderson, B comes after A, so branching enzyme, McArdle muscle glycogen phosphorylase, and H stands for glycogen phosphorylase. So these are the easiest way to remember the enzymes associated with glycogen storage disorders. In von Gierke disease, as there is no enzyme glucose 6 phosphate, no glucose formation from the glycogen, so it will present as hypoglycemia. As the excess of glycogen is stored in a liver, it will lead to hepatomegaly, renomegaly, there will be increased uric acid, increase in triglyceride, the face will be doll-like, and there will be a presence of acidosis. This is classical presentation of type 1 GSD. I hope you all understood and learnt well. It was very quick revision of one-liner for INI CET May 2023. Please let me know what else you would like to learn from me. Till that time, take care of yourself, study hard as well as study smart. Bye.